Hi, everyone. Welcome to the Top 5 Things FITS Should Know About series. I am Stella Hartono, past chair of the Quad AI FIT Committee. And in this session, we will be discussing the top 5 things FITS should know about RVUs. So joining me today is Dr. Vivian Hernandez-Trujillo. Dr. Hernandez-Trujillo is the director of the Division of Allergy and Immunology at Miami Children's Hospital, Nicklaus Children's Hospital. She is also the training program director for the Allergy Immunology Fellowship Program at the Nicklaus Children's Hospital, as well as the founder of Allergy and Immunology Care Centers of South Florida. Dr. Hernandez Trujillo has conducted basic laboratory research on B cells and agammaglobulinemia. Her research and interest has been in the areas of food allergy, anaphylaxis, and primary immunodeficiency disorders. She is an active supporter of young allergists studying practice as part of the Quad AI Practice Management Committee. So welcome, Dr. Hernandez Trujillo, and thank you for leading this session. I will turn it over to you to get us started on the top 5 items you have for FITS about RVUs.
Thank you so much, Stella, and thank you for the opportunity to talk about this. I am passionate about helping young allergists and in particular fellows in training to become as successful as possible because there's a lot of things that we can't learn. It's a limited time in 2 to 3 years that you do your fellowship. So I think it's just important to talk about these practical items. So today we're going to talk about relative value units or RVUs, which are really used to compensate some employees by different employers. So it may be a hospital group, it might be a health system, it might be an institution. And RVU compensation, when we talk about it, I'm going to kind of explain, it's supposed to account for the work of a physician. Okay, so that's your WRVUs, and that's part of the total RVUs. Physicians receive basically a certain amount of work RVUs for every patient exam or procedure that they perform. And then the Centers for Medicare and Medicaid Services, or CMS, assigns RVUs for each CPT code. Okay, so that's what you need to know. And the codes are predetermined based on the complexity of the procedure, or the patient visit. So the more complex the procedure, the higher the RVU, or the greater the RVU. And every year there's a different RVU. And I would actually recommend you can go to the Quad AI website, and you can look up RVUs, and every year they will publish a beautiful table of commonly used codes that we use as allergist immunologists and what the RVU equivalent is. And it even breaks it down into the cost, the how much the reimbursement is, facility versus non-facility. But really tonight, we're just going to focus on just the general numbers for RVUs. So the work RVUs are supposed to take into account, again, the time and the clinical skills of the physician. Another part of that's work RVUs. Another part are the practice expense or overhead expense incurred by the hospital or practice that are needed to perform the work. And then the third part of what's in the total RVU is the cost of professional liability insurance or malpractice, and that's the smallest amount. The physician's RVUs are multiplied by a conversion factor, which CMS every year they give a number. It's a specific dollar amount. And obviously, the higher the work RVUs a physician has, the more money that they can potentially earn. So just kind of keeping that in mind when you, for example, are given your first employment agreement or a contract, and if it states that you are expected to perform X number of work RVUs, my recommendation is, and it might sound a little complicated, but I honestly, it's not. You can kind of go backwards and say, okay, well, if I'm working X number of weeks per year and X number of days, you can come down to how many work RVUs would you actually need to perform per day to get to that number. Because it's one thing if it's productivity based, and if you have a base salary and then there's extra, if you'll get a bonus or incentive for productivity, that's one thing. But some people may actually just have a straight work RVU base. So you may say, well, how do I know what's a fair number? That's really the way to do it. So using that formula and using the table, you can say, okay, well, I would need X number of follow-up visits or X number of new visits per day or X number of procedures. Keeping in mind that procedures such as skin prick testing give you a very small number of work RVUs. Just keep that in mind. Okay, so that's really my tip number one, just in general to kind of go over what is an RVU and what is a work RVU. Um, Number two, it's important to get credit for all the work that you do. And I often say this to young allergists and to FITs, because all the work that we do, there's a lot of things we don't get paid for. We may not have enough staff. We have to get some prior auths. We spend the time on that. We may have patients calling for lab results. You need to determine how you're going to practice. So you may decide, I have to spend time going through lab results. I'd rather have a visit with a patient and be able to bill that visit and be able to answer their questions and give them the time that they deserve. And honestly, many practices do that. Others may choose to do something different, but I'm a firm believer that whatever work you're doing, you need to get credit for. So if that means sitting down with a patient and then billing an E&M code, that may be, one way to do it. And just keeping in mind that when you're addressing concerns, your time is as valuable as your patient's time. And, if we really look back to the last almost 20 years, since 2008, our reimbursement continues to decrease. Okay, the conversion factor continues to go down. And we can even go way back to like 2001 and even a little before that, where the numbers have really varied very small amount and what our um the reimbursements are. But the reality is that our expenses, like every other industry, continues to go up. So I really believe we're one of the few industries where we're doing the same work and sometimes even more work, because there's a lot of things and regulations that have been put into place that we may not get compensated for that time, but that time goes in and we're just receiving less and less and less reimbursement. So just kind of keep that in mind. So give yourself the credit, give yourself the time. And if you have a visit, you can bill a visit. If it's a patient that you're following over time, there's different codes. This is why it's important to be up to date with the billing and coding. There are different codes that you can use for patients that are more complex that you may be following, you know, once a month or a few times a month. And that's important because that time also can get billed. Tip number three, whether you work for an institution or a private practice, I really encourage you to be aware of the number of patients that you're seeing. So, more or less, how many news versus follow-ups, how many procedures, so that at the end of the month or quarterly, you can say, I know that these were my RVUs, because I can't tell you how many times you're going to sit down with someone. It might be administration at an institution that's telling you, well, these are your numbers, and they don't have the correct number. So you want to make sure that, again, you have the correct information so you can say, well, actually, I know that I saw X number of news. I saw X number of follow-ups. These were the procedures that I did, so that you can have an idea. And some people I actually kept a spreadsheet, not with patient information, just how many of those visits. So when I would sit with administration, I had that information. Now, as a practice owner, it's very important to be, very closely looking at the numbers. So I think that that's just something, and I would encourage you, whether you are, again, employed by an institution, a private practice, you want to be aware of those numbers because you want to be fairly compensated, especially if it's incentive based or productivity based. Okay, so that's important. It's going to be really important when you go to renegotiate a contract or employment agreement. And it's also important because if you need to know exactly how much, how many patients, how many RVUs, you want to be able to substantiate that. Tip number four is that we as physicians honestly need to get more involved. So I already told you, CMS sets those numbers every year. Our reimbursement continues to go down. We really do need to be vocal because all the expenses are going up, and we are passionate about what we do. And we should be receiving the credit that every other industry, and unfortunately, it's not like that. And our job, one could argue, is actually more important than many places, many other jobs, because this is life or death in many situations, right? So we really need to get involved. We need to be vocal. I encourage you to get involved in the Quad AI, get involved with organizations that represent us. And really, part of our responsibility is not only getting involved, but supporting those who are helping to support our field, because allergy immunology is a small but mighty field, and we're very, very important. Without us, honestly, many parts of the hospital cannot function without us, and many other subspecialties. So keeping that in mind. And then number 5, so we are in an ever-changing landscape. Our measures of work may change over time. I cannot encourage you enough to stay abreast of all the changes that are happening with billing and coding, and this happens every year. From the time that I was fit, actually, until now, the practice management workshop, and I will say that I am the current practice management committee chair, but it is an annual workshop that the Quad AI offers, and it's so important. The webinars on coding and billing and staying, on top of all that information that does change, but that's vital information for us. And that really helps us, because if we know, we don't want to get denials. We want to make sure that when we send a claim, it goes through. And there are some times when some of the E&M codes we have to know, like a certain amount of time. If you're doing your time-based coding and you're spending the time, then bill based on time. If it's a complexity, that's different. But if you are spending the time with the patient, bill it, document it, and then make sure that you're coding correctly. So I hope that these top 5 tips for RVUs have been helpful, and I'm happy to answer any questions. You're muted, Stella.
Sorry about that. Thank you so much for all the tips that you gave us. I think that's like really, really helpful, especially your tips about being involved. I know that like I've been involved so much with the Quad AI, and it's been a true pleasure doing that. Okay.
I would encourage all the fellows, and just see what you're passionate about, right? There are committees
Mhm.
for everything. So whatever you're passionate about, I would encourage you to get involved. And sometimes when you get involved with one, then you realize, oh, I actually am interested in this as well. And I agree
Mhm.
with you. From early on, I was involved in the committees, and that is just such an opportunity to also network and get to know people. And that's really how I've met many of my mentors.
Yes. So again, thank you so much for volunteering your time. I really appreciate the information and the guidance that you shared, for the fits. So all of you guys, if you have any follow-up questions after following this and after viewing this session, please reach out to our fit staff liaison, Mary, at Mari Duran. So it's MDURAN at quadai.org. See you guys soon.